Hey everyone, I just wanted to come and update you with my progress. I'm just waking up, excuse my appearance and my messy bed, but December was a rough month. After my recovery from surgery, I experienced a lot of abdominal pain, and true to my form, I experienced some complications after surgery. This time, not related to the surgery per se, but I had like a huge ovarian cyst and then it ruptured. So I was like in extreme pain for like another 2 weeks than I should have been. So I am now regaining my strength. They think as a result of that is the reason why my hemoglobin has been so low. I'm on iron pills, but I don't have a lot of energy. My hemoglobin is still really low. They think I'm bleeding from somewhere. They think it could be from the cyst that ruptured, or maybe from something from the surgery. But the hemoglobin isn't going down rapidly, so they're not worried. I guess if it's a slow leak, they're not concerned. I don't know. I think that I'm concerned. It just always, it's always something. But my energy is coming back. I'm able to actually get out of bed. December through my birthday, January 6th, I was basically bedbound for the most part, which was really tough because I'm a pretty active person and I like to get out and do things. So my mind wanted to do all these things, but my body really didn't. My blood pressure was really low. It was like in the 80s over 50s, and every time I would get up, I'd get really dizzy. Now it's in the 90s over 60s. My days, I can go to the grocery store and shop for, a week's worth of groceries, and then I'm done for the day. Or I can do a room cleaning in my house, deep cleaning, and that's it for the day. Or, run a few errands and I'm done for the day. So I don't know if that's me still regaining my strength from being in bed for a month. I don't know if that's me still healing from the surgery. I don't know if that's still from my anemia. I'm not sure. Other things that are going on. I am still losing weight at a pretty rapid pace. November, before my surgery, I was losing weight steadily. I thought after my surgery that would stop. I thought after they fixed the small bowel obstruction that it might stop, but I was 170 and now I'm at like 141, and I lost like 7 pounds last week, so that's concerning. Eating is still hard for me. It's painful, and when I say painful, I mean like it burns and hurts, and like I can almost feel it go all the way down my intestines. So they put me on Carafate, and I'm also on Prilosec daily. My surgeon said I'll probably be on Prilosec for about the rest of my life. Yeah, so what's next is we're going to keep an eye on my weight, my iron levels, the pain in my stomach with eating. I'm trying to think of what else. Oh, the nausea is back. Yay. Taking about 8 milligrams of Zofran a couple times a day. Sometimes that's not enough, and I'll take motion sickness pills on top of that, and that just knocks me out. So I guess the best thing I could say is that I'm alive and my energy is coming back and I'm hopeful. I did also finally get into the University of Michigan's GI system, which takes months, and I was luckily able to get in right away after the new year, which is kind of a miracle. So I'm in their system now, so I kind of have them as a second opinion, which is comforting to me now, because with all the complications that I've had, I don't know that I have 100% faith in my bariatric team, especially with all the complications. So that's where I'm at. I don't know. I'm just really grateful for every day that I have, I guess. It really, really makes you kind of humble and appreciate each day. I don't know. I've seen a lot of doctors. I was in and out of the hospital with the abdominal pain with the cyst, and they were looking at my surgical history, and they were kind of amazed, and a few of them said that they were really surprised that I was alive in a way, because some of my surgeries were very, very serious, and so kind of put a lot of things in perspective, and I'm trying not to take anything for granted. Also, I realize that, this might not be over. It's just the truth. My doctor told me before my last surgery, before this hernia surgery and the small bowel obstruction hernia, or surgery, excuse me, that this might not be the end, that this might, yeah. Anyways, all in all, I'm doing about 70%. I just have a little cold, that's why my voice sounds like this. And yeah, I just wanted to give you an update. I'm going to try and continue with regular updates, just because I think I want people to know, I know it might not be common, but these are the complications that can come with a gastric bypass, and it might give someone pause and think, maybe I should think about this, because I regret the surgery at this point. At this point, I do. I wish I had done the sleeve. I wish I hadn't been so new. And I wish I just had more information on it. And I wish I had made a different choice. But, this is this is what I have to deal with, and this is what I will live with and get through and deal with, and hopefully I will do it with grace and dignity, and yeah, hopefully I can help someone else out there through this somehow, and at least let them know that they're not alone, or at least help them in some way. That's my goal. So hope you're all well, and hopefully my updates will be more positive and cheerful, and they won't be so anyways, be well. Bye.